Ladies and gentlemen, let us all welcome our moderator for the day, Ms. Carmen Oste.
Good afternoon, magandang hapon, and mabuhay from the Philippines. I'm Carmen Auste, your learning partner and moderator for this afternoon session on what's new in the region about breast cancer. I am the CEO of Cancer Warriors Foundation and Vice President of Cancer Coalition Philippines, of which the convener of this event, ICANSERVE Foundation, is also a founding member. I also represent patient support organizations and civil society in the Philippine Integrated Cancer Control Council, various special bodies in the region, and WHO Geneva. Our session today promises to be both enlightening and inspiring. It brings together a WHO Geneva-based global thought leader and prime mover in breast cancer, as well as showcases two very successful social innovations from Indonesia and the Philippines on breast cancer care and patient support. Our first presenter for this afternoon, that we are all very privileged to hear from, will share with us the operating framework of the Global Breast Cancer Initiative and key actions that we need to support and work on together. He is no other than Dr. Ben Anderson. He is currently the Medical Officer for Cancer Control of WHO Geneva and leads the Global Breast Cancer Initiative that was launched just last year. The title of his presentation is Shedding New Light on Breast Cancer Early Detection. Let's give a listen to Dr. Ben.
It's a great honor to be able to present to this esteemed group again this year. What I will be discussing is the Global Breast Cancer Initiative, and specifically focusing on the area of early detection. What do we think about in terms of low and middle income countries in limited resource settings? Our prior work with the Breast Health Global Initiative from the University of Washington and Fred Hutchinson Cancer Research Center received support from Susan G. Komen. I am now working with the World Health Organization separately from that, and so some of the things I will be talking about will be from the perspective of BHGI, and the other will be from the perspective of WHO. So let's begin by discussing how breast cancer outcomes can be improved. We know that breast cancer today is the most common cancer around the world. This is taking men and women together. It is the most likely reason that a woman will die of cancer. There are more disability-adjusted life years lost among women to cancer than any other malignancy. The majority of breast cancer cases and deaths occur today in low and middle income countries, and that problem is worsening. By 2030, 75% of the projected 2.2 million new cases and the 817,000 deaths will be in low and middle income countries. There's this broad range of how we do with breast cancer. The 5-year survival in high-income countries is better than 90%, but 66% in India and 40% in South Africa. That's clearly a statement of disparities. It's also a statement of opportunity, because we recognize that we do know how to improve breast cancer outcomes. The question is how to apply this in settings that have some but not all of the tools in place. If we look specifically at sub-Saharan Africa, where half of the breast cancer deaths occur in women under the age of 50, for every 100 cancer deaths, there are 210 children that become maternal orphans. So this is not just a social problem and a financial problem, it's a generational problem. And this is one of the reasons we need to be addressing this today. We've seen in high-income countries that when we began screening, early detection in the early 80s, that about 8 years later, we started to see a drop in breast cancer mortality. And so that clearly gives us optimism that early detection is one of the tools that we can use. However, it's important to recognize that while early detection is essential to improving outcome, it only works when it's followed by breast cancer treatment. It's the linkage between early detection and treatment that makes this effective. That is the approach that the WHO is taking in the context of developing the initiative. So the Global Breast Cancer Initiative has a setup of objectives and pillars that is being addressed at the global level. The overall objective of GBCI is to reduce breast cancer mortality by 2.5% per year, which would save 2.5 million lives over a 20-year period. There are three pillars to the Global Breast Cancer Initiative: health promotion for early detection, that's an educational initiative; timely breast diagnostics; and the third pillar is comprehensive breast cancer management. But conceptually, what we're doing is we're marrying two different approaches. One, the population-based approach, public health sciences, where we look at countries and regions as a group, with clinical management, because it was actually clinical management that allowed those improvements in high-income countries to take place. So consider these curves from mostly high-income countries, where there was a drop in breast cancer mortality by 40% between 1990 and the present time. And if you look at the slope of those curves, that drop was between 2 and 4% per year. So when we talk about a 2.5% drop in breast cancer mortality globally, that's not a fictitious or artificial number. That's a real number that was actually achieved with tools that we would consider standard today. The question is, how do we translate this to limited resource environments where we have some but not all of the tools? And again, the concept here is to use clinical management. And we are dividing this into three intervals corresponding to the three pillars: the patient interval or pre-diagnostic interval, where the patient enters the system; the diagnostic period, where we determine who has cancer and who does not; and the treatment interval, where we manage those cancers effectively. In those early steps, the health promotion for early detection is an initiative based upon education. We need to provide education to the public, to women, to their families, to understand what is early detection, what is breast cancer, how would I recognize it, and why would I come in early? How does this help me? And we want to link these educational initiatives to other existing frameworks so that we're not just duplicating or siloing our work. Since cervical cancer is recommended for screening between ages 30 and 49, this is also an opportunity for breast health education to understand the disease. But we also have to provide education to the providers so that they recognize early stage disease or potential early stage disease and refer the patients for diagnostic management. So education at the primary care level through tools such as PEN, which is a WHO initiative, but also education about clinical breast assessment to the district hospitals, where those providers can actually perform these diagnostic workups. The target of this, which is the core of today's discussion, is to stage shift such that at least 60% of the invasive cancers are stage 1 or stage 2 at diagnosis. We will come back in the third portion of this talk to what that means and why that is. The second pillar is timely diagnostics. We need to be able to show that cancers are cancer or benign within a reasonable period of time. And this is using what tools that today are standard: ultrasound, basic pathology services, and we can use leapfrog technologies, these new approaches to proving what is cancer and what is not. We don't always have to reproduce what is done in high-income countries. But we also have to think about navigation. How do we get the patient through the system to make it all the way to treatment? We want to be able to make a diagnosis within 2 months. And the reason that 2 months is a reasonable target is that it's at 3 months that we start to see gradual declines in breast cancer survival. So by targeting 2 months, we can realistically start treatment within 3, which is an evidence-based approach. The third pillar is treatment. How do we manage cancers in ways that are effective and reasonable? And this, whether one is in Latin America, in Peru, at a regional cancer center, or at Tata Memorial Hospital in Mumbai, where we have to be able to manage the cancers once they are proven to be disease. These are standard approaches that are well understood in high-income countries. It's based upon timely, multidisciplinary treatment, and the goal being to complete treatment without abandonment. That means to get them all the way through treatment and not stopping partway through. That requires multidisciplinary planning, more patient navigation, and particularly important, measurement. We have to be able to assess how are we doing? How are the patients doing? You can do all of the right things, but if you don't measure, you won't know if it's been effective, and therefore you cannot spread these approaches to other areas. But we can't forget about the women once we're done with treatment. We need to be able to reintegrate them back into the society. We have to think about issues like financial toxicity, which is a huge issue. And we have to be able to have follow-up care and survivorship management. The goal is to get 80% of patients through treatment without abandonment. Because if we only partially treat the patients, which is very common, then we get the worst of all outcomes. It means you get the side effects without the benefits, because the benefits of treatment are by doing everything within a time frame. Here is data from sub-Saharan Africa, and what you can see is looking at several countries. In sub-Saharan Africa, they vary among countries and sometimes within countries, but only about half of the patients that began treatment actually finished it. That is assured to have suboptimal outcomes. And in fact, the 3-year survivals at that time that this study was done were really suboptimal. So we need to be able to think this through. So what does this say about early detection? We, for a long time, have focused on mammographic screening. The reason for that is that we have these trials going back to the 1970s that showed that when we screen women with mammography, that we are successful in reducing breast cancer mortality. And the great majority of those randomized trials showed survival benefit. It's very important to note that that evidence is for women ages 50 to 69, perhaps extended to 45 to 74. So that doesn't tell you anything about what to do for the younger women under the age of 50, or at least under the age of 45. And furthermore, it doesn't realistically portray the complexity of setting up mammographic screening. Because to do mammographic screening, it's not just getting the mammograms. That's the easy part. It's that you have to be able to follow the women over time. You have to bring them in every 1 to 2 years. A screen-detected cancer is one where there was a negative mammogram before, a positive mammogram on the next round. And so just getting a mammogram is not screening. And therefore, we really have to think this through. The question becomes, if we screen, which is what is portrayed on the left side, we have to screen very large numbers of women. If we screen 1,000 women, perhaps 7 will have cancer, but there will be over 200 that will need some diagnostic workup. If we wait and we identify women at the point at which they have early symptoms, small lumps, subtle findings, it's a much smaller number, much more practical number of women that need to be worked up. But the question is, if we wait until they have symptoms, is that too late? We now have the Mumbai trial that was published last year, in which they used clinical breast exam as a screening tool, meaning that they underwent repeated clinical breast exams every 3 years. And in fact, not only was there downstaging where early detection was successful, but there was an overall survival benefit for women 50 and above. So we now know, yes, it is possible to improve on outcomes when women are symptomatic if they're early. This doesn't mean we have to set up clinical breast exam as a screening tool, but what it does say is the clinical systems of taking a history and doing a physical absolutely can be effective and cross thresholds. So where did this 60% number come from? You will recall at the beginning of the talk that there were countries that had that reduction in breast cancer mortality. We published a study last October that showed that of the countries that we looked at 148, we had 35 that had adequate data to look at both mortality and stage distribution. Of those 35, 20 had that dropping breast cancer mortality, while 15 did not. And that, when we said, what was the difference? There was this threshold, 60% of the invasive cancers at least being stage 1 or 2, fewer than 40% being stage 3 or 4. And so this gives us a new way at looking for early detection markers. Instead of asking the question, did you set up mammographic screening or not, which may or may not be feasible, We're instead asking the question, how far are you from this threshold? Because that's how we want to base our interactions. And maybe you are ready for mammographic screening. Maybe if you have very advanced tumors, doing that educational work, that's what's going to get you closer to this goal. So in summary, breast cancer is what we refer to as an index malignancy. It means if you can do breast cancer, there are a lot of cancers that you can address. And therefore, it is a fundamental tool for organizing health systems to address cancers, early detection, diagnosis, and treatment. To be effective, breast cancer early detection needs to be followed by effective and timely treatment and supportive care. So we have to think in terms of that comprehensive system and health system strengthening. A country's staging diagnosis profile and using this 60% threshold, this is a new way for looking at early detection because it helps us define what are the appropriate early detection strategies for a different region. As such, the Global Breast Cancer Initiative can be a catalyst for changing the developing approaches that is relevant not just to breast cancer, but to cancers overall, to women's cancers and women's health throughout the life continuum. Thank you very much for your attention today.
Not only shed light, thank you very much, Ben. That did not only shed light, it brought a lot of hope to all of us. It was most inspiring, very incisive, and very informative as well. Thank you as well for bringing in that fresh insight that breast cancer is not just a public health issue, a family challenge, but more importantly, a generational problem that we all need to work together, given the effect on families and those left behind by men and women with breast cancer. We also need to be reminded of the importance of the 3 pillars and the action pathways which you spotlighted, clearly showing us that there are ways by which we can improve and accelerate better health outcomes for men and women with breast cancer, as well as help to create a better future for the breast cancer community. At this point, we go from Geneva to the Philippines. Let's welcome from the Philippines a local change master and a very passionate social innovator, Dr. Cecille Montales. She is the overall head of the program of the city of Taguig, which is a major city in the National Capital Region of the Philippines with a population close to almost 1 million. Cecille is also part of the board of the ICANSERVE and heads their Patient Services Committee. So friends, let's give a listen to the experiences of Dr. Cecille in setting up and sustaining a local government unit community-based model, Ating Dibdibin, which roughly translates to Let's Take It Seriously. And the program is the Hand on Heart Patient Advocacy, a breast cancer control program in an LGU in the Philippines. I promise you, this is going to be very exciting.
Greetings to all of you here today in this meaningful event. I am Dr. Cecille Montales from the city of Taguig, a proud breast cancer survivor and a volunteer advocate of the ICANSERVE Foundation's Ating Dibdibin program. According to the Department of Health and the Global Cancer Observatory, breast cancer is the 3rd leading cause of death in the Philippines and the most common cancer among women in the country. Similarly, the Philippine Society of Medical Oncology says that breast cancer accounts for 15% of all new cancer cases in the country for both sexes and 8% of all cancer deaths. Despite the statistics, the country has no national screening program for breast cancer. ICANSERVE Foundation, a non-government organization, responded to the lack of a national screening program and bridged this gap by initiating partnerships with different local government units such as Marikina, Taguig, and Muntinlupa in the National Capital Region, and Panabo and Tagum in Davao region. We were excited to partner with ICANSERVE because Taguig takes the fight against breast cancer to heart. Taguig also has one of the most number of community health workers, which is a testament that we really place high value on health programs. We likewise take pride in having a female mayor, Mayor Lani Cayetano, who is a strong advocate and champion of women's health and rights. As such, on 26 March 2012, our city and ICANSERVE began our partnership and formally launched a hallmark program on breast cancer called Ating Dibdibin Program. It was subsequently institutionalized or made permanent through local legislation. Taguig passed Ordinance Number 17, Series of 2012, providing medical assistance under the Ating Dibdibin Program, appropriating funds thereof, and for other purposes. Ating Dibdibin Program is a barangay-based early breast cancer detection as well as control program with patient pathways to diagnosis and treatment. It aims to widen the scope of care for women and men with breast cancer. It also aims to screen patients for early detection and proper diagnosis of breast cancer so they would be seamlessly and immediately referred and monitored for treatment. This is due to the belief that early detection helps in immediate diagnosis and treatment, paving the way for survivorship.
ICANSERVE Foundation trained all the community health workers and did screening in all barangays.
Our partnership designed a referral system so our patients diagnosed with breast cancer or those with the suspicious findings can have easy access to free and affordable diagnostics and treatment. Additionally, a breast clinic was immediately established in our local hospital, Taguig Pateros District Hospital, and this clinic is well equipped with ultrasound, mammogram machine, and chemotherapy rooms. We have surgeons in this hospital who do biopsy and surgeries such as mastectomy, lumpectomy, and other breast-saving procedures. We also have an oncologist to manage and oversee the chemotherapy of our patients. Our city is blessed to have been introduced to Patient Navigation Program, which served as a driving force and a critical initiative that led to the success of the program. The patient navigators guide patients through the continuum of care and helps them overcome barriers. They are community health workers who underwent patient navigation training given by Philippine Cancer Society and ICANSERVE Foundation. They learned how to assist patients with their treatment schedules, medical appointments, and diagnostic tests, as well as with obtaining the financial, legal, and social support they need to manage the complexity of their conditions. This community-based approach is important to establish trust that will be at the core of the relationship between the navigator and the patient. Since the patient personally knows the navigator, she can encourage and motivate the patient to continue with the treatment journey and remain optimistic. This program has greatly aided us to quell the fear among women to get screened or treated. Through the years, our local navigators were able to help individuals to get screened and treated at their own accord. Facebook messaging groups were even created between navigators and their patients to freely open their line of communication in case they need further help or assistance. The patient navigators in Taguig have the following roles and functions. At the City Health Office, assist patients for medical assistance offered by the city and other agencies like the Department of Health and Philippine Charity Sweepstakes Office. Arrange free patient transport, manage data under the Ating Dibdibin Program, and manage the digital patient diary. At the breast clinic, assist those screened in health centers with positive findings, provide and guide patients with information that will enhance their ability to make appropriate healthcare choices and receive medical care with full understanding of the disease risk benefits, and responsibilities. Assist patients in their chemotherapy sessions. In all barangay health centers, conduct branch conferences all year round, refer patients screened with positive findings for surgical consultation at the breast clinic, connect patients and navigate them through our healthcare system, as well as support them in diagnostic services and treatment, and accomplish the digital patient diary. At present, there are 39 patient navigators across all the 31 health centers in the city. Each center has one patient navigator except for some bigger barangays which have 2 to 3 patient navigators. There is also one patient navigator assigned at the City Health Office and 2 at the breast clinic. As we look forward to celebrate the Breast Cancer Awareness Month in October, I would like to share with you our initiatives and activities in the local government against breast cancer. Oktober, a major breast and cervical cancer screening event with 500 to 1,000 participants. Breast cancer awareness and screening kiosks in malls and other establishments. Picture Perfect competition for all breast cancer survivors in the city who wish to share their own stories as captured perfectly in photos. Pink Bestie Workplace, a breast cancer awareness booth competition in all health centers. Webinars during the pandemic, and for this year, in addition to the activities mentioned, a walkathon. In 2016, Taguig City helped to establish the Pink Crusaders, a breast cancer support group. The city recognizes the role of a support group in the fight against breast cancer. This has become the venue for the members to share their experiences, feelings, and coping strategies. Activities include dance exercises like Zumba and lectures on nutrition, urban gardening, and mental health. Aside from quarterly get-togethers, to help increase feelings of hope and empowerment, there is also a group chat in FB Messenger. The Pink Crusaders support group has 278 members. For this year, a bigger breast cancer center in a new building will open to provide patients with a more comfortable and more convenient venue for their consultations, diagnostic procedures, and treatment. A research center, meeting room, and activity center for patients or survivors will also be included in this building. We're also excited with the digitization of data project with ICANSERVE Foundation. We initiated the digital patient diary this year, and the project of ICANSERVE came at the right time because it will greatly help us in monitoring and tracking the progress of our patients. According to Dr. George T. Ignacio, Director of Philippine General Hospital Cancer Institute, they have seen fewer breast cancer patients from Taguig since Ating Dibdibin started. Due to its widespread information campaign, patients are familiar with Ating Dibdibin program and are confident to avail of its services. Our beneficiaries continue to hold their heads high and say that they feel no shame that they have cancer, all thanks to the continuous support given by the city. They also feel empowered and less worried because of how Ating Dibdibin helped alleviate financial problems or costs that come with a cancer journey. This is our legacy, and this is why, when the time comes that our national agencies will start prioritizing breast cancer, we have far taken the lead and continue to be ready. Thank you.
Thank you very much, Dr. Cecille, for sharing with us the highlights of that very impressive journey in Taguig. We want to give a big shout out to all the patient navigators in Taguig who are the backbone and the fuel that propels this program to continue to help more and more men and women in their city. At the same time, this particular sharing showed us what creativity, collaboration, commitment, and a drive to continuous improvement can create in our local communities. So this definitely is something that should inspire us to either replicate, adopt, or scale up what we have right now in our countries. And now from the Philippines, we bring you to our neighbor country, one of the closest to the Philippines. And for me, I never forget Indonesia because we were so proud of having 1,700 islands. Then I went to Indonesia and discovered they have 17,000 islands, and their population is double that of the Philippines. The good afternoon that I have been taught, that I hope I remember and pronounce correctly for our friends and colleagues in Indonesia and the breast cancer community there, is Salamat Siang. And all the way from Indonesia, joining us to be able to share the social innovation that they have started in Indonesia. And by the way, they were the host of last year's summit. We have here with us, the short name that you can all remember is Ning. In the Philippines, Ning Ning is shining bright. And truly, our guest has helped a lot to make sure that the Indonesian Breast Cancer Foundation shines bright, leading the way for innovations to help more and more women with cancer. On a personal note, her youngest sister is actually a co-founder of the Indonesian Breast Cancer Foundation, of which she currently is the vice chairperson. And for those breast cancer survivors, our sisters, she is one of you, one of us. She's an 11-year breast cancer survivor. So friends, let's welcome our sister, our champion, our prime mover from Indonesia.
Thank you, Carmen. It's very nice of you. Good afternoon to my friends from all breast cancer communities in the Southeast Asian countries, my friends from the ICANSERVE Philippines, my friends from Indonesia, the honorable speakers from all over the world who are attending the conference online, and also who are here attending offline in Manila. It is a pleasure to me to meet you again after the last year's virtual SEABCS 2021 in Jakarta. I'm Ning Anhar, the Vice Chairperson of the Indonesian Breast Cancer Foundation. Mrs. Linda Agum Gumelar, the Chairperson of the IBCF, sends all of you the best regards and a wish of success of the SEABCS 2022 in Manila. Thanks to Cara and the SEABCS 2022 committee for allowing myself to present the extension of Community Healthcare Outcome, or ECO, telementoring training program on breast cancer early detection and the referral ecosystem in Indonesia. I'm here also with my friends, my colleague, Mrs. Nani Firmansyah, who is the trainer for practical breast self-examination and the head of the IBCF shelter home. She's here with me. Thank you, Nani. Now I'm going to back to the my presentation. The title of the project is Improving Breast Health Awareness and Breast Cancer Early Detection for Better Breast Cancer Outcome. It is a pilot project to empower the frontline healthcare workers and volunteers through a telementoring and structured training program. The pilot project is being organized and implemented by the Indonesian Breast Cancer Foundation, a non-for-profit breast cancer organization based in Jakarta, which is partnering with the Breast Cancer Care Community, a breast cancer organization based in Tangerang District, Banten, Indonesia. We are collaborating with the National Cancer Center Darmais Hospital, Tangerang District Public Hospital, Tangerang District Government, and Tangerang Health Authority in implementing this project. This is a one-year pilot project, which was launched in February 2022 until February 2023. This pilot project is using a platform from the ECO India and is fully supported and monitored by the ECO International, ECO India, and Roche Indonesia, especially on the initial preparation of designing the ECO model telementoring and a structured training program, and also technical support on the IT facilities. Next slide, please. Next, please. Globocon 2020 reveals that breast cancer new cases in Indonesia keeps on increasing, and it is the highest woman cancer cases with 65,858 new cases, and the number of deaths is to 22,430. It has been the biggest contributor for mortality and morbidity among all cancers in Indonesia. Almost 70% are detected at late stages. The hospital-based data of breast cancer cases at the District of Tangerang in 2019 shows that there was 4,289 cases, and majority came to the hospital at late stages. The majority of women community at the District of Tangerang are not aware of the importance of breast cancer early detection. Therefore, the project aims to increase awareness of breast cancer, self-examination, breast health, and to promote clinical breast examination among the primary healthcare providers to help downstaging the breast cancer cases in the area, and also to train how to refer to a hospital for further check-up by a medical oncologist once a patient is suspected to have a malignant lump on her breast. The objective of this project are to support the establishment of hub and spoke model, and then to conduct an online training on breast cancer early detection, referral ecosystem, and to conduct field monitoring and evaluation on the implementation, to disseminate knowledge and methodology for improvement of early breast cancer awareness. Next slide, please. The target group of trainees are 100 frontline health workers, health volunteers, laywomen from local patient organization and community. The site of the training are 2 primary health care at the Tangerang District, Banten, Indonesia, which become the spoke of this project. The hub, or the Center of Didactic Materials, is National Cancer Center Darmais Hospital and also the Indonesian Breast Cancer Foundation. The subject matter expert or the medical experts will be from the National Cancer Center Darmais Hospital and the Indonesian Society of Surgical Oncology. The project activities consist of 3 phases. Next, please. The first 3 months, which is from February 2022 to May 2022, was the development of need-based training materials, curriculum, timetable of the agenda of curriculum, promotion and education materials, including appointing the right medical experts. The second 6 months, from June 2022 to November 2022, is the training program and certification program for 100 participants, and the didactic training materials are delivered on a bi-weekly basis, which consists of 12 topics, which are full knowledge of breast cancer from early detection, follow-up, medical treatment, and to palliative care. Topics about psychological and cultural sensitivity effect and how to communicate effectively to patients diagnosed with suspect breast cancer, healthy living and sharing experience. We are also conduct a practical breast self-examination to the participants using a breast mannequin. The last 3 months, slide next please, will be the project monitoring, evaluation, and producing reports and recommendations. Next please. Next. It is expected that after the training given during this project, there will be behavior changes as the result of awareness, which lead to women community in Tangerang district to regularly perform breast self-examination and seek for further advice in the case of abnormality detected. As the result of the training program and the practical for breast self-examination, the trainees are expected to educate women in their closest communities. The establishment of the ECO model will accelerate the expansion of awareness and education program, especially in the district of Tangerang, Banten, Indonesia. This is also expected to contribute the breast cancer downstaging at the district of Tangerang. Next, please. It is also expected that this ECO telementoring program will accelerate the expansion of awareness and education program, especially in the remote areas, in alignment with the National Cancer Care Network Establishment Plan of the Darmais National Cancer Center and the Ministry of Health, Republic of Indonesia. It is also expected that the ECO telementoring program can be adapted by the Ministry of Health for application at the national level. Next, please. Here are some photos while the trainees are in class and online. Next, please. Another photo shows, next, please. Next. Okay. Another photo shows how the trainees are providing breast self-examination practice, and a photo, next please, and a photo of a patient with a suspected malignant lump who is being referred to the district of Tangerang Public Hospital for getting further treatment. After this, Mrs. Yuli Iskandar, the chairperson of the Breast Cancer Care Community of Tangerang District, will present through her pre-recorded video about the reason the ECO model training program is being delivered in the district of the Tangerang and the result of the program. Thank you.
Good afternoon, my name is Yuli Iskandar, the head of Tangerang Breast Cancer Community, and today I'll be sharing the benefits of the ECO program in Tangerang. There are 37 provinces in Indonesia in total, with one of them being Banten province. The region I am in charge of is Tangerang, one of the cities in Banten. The population of Tangerang is 3 millions, 1.58 millions are men, and 1.52 millions are women. The area of Tangerang Regency is 1,034 kilometers. Tangerang is chosen by the Indonesian Breast Cancer Foundation, ICAPI, as the location where the project is held. As Tangerang has a breast cancer care community, KPKPKT, that has received a decree from the local region head. And our public hospital has been the place where all breast cancer cases in the Banten province has been referred to. The pilot program was carried out in 2 primary care centers in Tangerang, Curug and Kelapa II, with 100 female participants from various jobs such as healthcare providers and workers. There are many benefits from the ECO program. First, raising awareness on breast cancer sharing information on how to perform self-examination and the sign of breast cancer. Second, the program helped prevent late detection of breast cancer cases. Third, help the development of skills and capability of the healthcare workers and community in Tangerang. Fourth, allowing the sharing of knowledge not only to those who participate, but also to the family and community. And the most significant is that allows unnoticed cases to be discovered. During the pilot program, 11 cases were found in the centers. All the cases are currently undergoing further examination and are in process of therapy. These are the charts and surveys from the ECO program. In the middle, participants give positive feedback and felt satisfied with the program. From the pre-test and post-test result, there is also a significant change in the knowledge of breast cancer. The video of the clinical breast examination education will be played after this.
Inspeksi, kita menemukan bentuk payudaranya di sini tidak simetris, kanan dan kiri. Kebetulan yang kanan agak lebih besar daripada yang kiri. Ya, betul. Maaf, yang kiri besar. Yang kiri lebih besar. Kiri yang lebih besar daripada yang sebelah kanan.
Iya, diputar. Dia tangan di atas gini, Bu. Juga diputar.
Batas-batasnya, Bu. Batas-batasnya dari tulang sini ini tangan ya, sampai ke bawah tulang sini. Batas-batasnya.
Terus diputar dengan halus gantian.
Dari luar ke dalam, dari luar ke dalam.
Ayo terangkan ayo. Kalau
Ayo, Miss. Ketek-ketek.
Tangan gini. Sini kasih bantal ya, Bu.
Ibu kalau yang di depan kaca nanti praktekan putar dulu.
Ya, depan kaca ya, Bu ya.
Di depan kaca. Tangan. Ya, sambil dilihat di kaca nanti ya, dilihat di kaca ya. Ya, kalau yang kanan tidur.
Ini ada bantal ya, Bu ya.
Bantal, dikasih bantal di sini. Dikasih bantal di sini ya, dikasih bantal. Di dada senjata dada ada. Oh itu hanya darah. Dikasih bantal nih.
Di sini sampai berapa?
Ya, sama yang satu ke ini abunya ini.
The ECO program has given us many opportunities to further raise the awareness of breast health and breast cancer. We hope in the near future this program can be implemented throughout Indonesia. Thank you, Southeast Asian Breast Cancer Symposium, ICANSERVE Foundation, and Indonesia Breast Cancer Foundation for the opportunity and time.
Honorable former mayor of Guaga, Pampanga, which is about 1.5 to 2 hours travel from Metro Manila, depending on the traffic. You all know about the Philippine traffic. Is none other than Honorable Dante Torres. He is a very passionate advocate of the healthcare system development. And during his term as a mayor, there were a number of initiatives that he was able to introduce, part of that of which is a program similar to what we have heard from Indonesia. So later on, we will be hearing from our Honorable Mayor in terms of what he sees are some of the similarities between the Indonesia model and the model in Pampanga, as well as some of the challenges that they face. He also supported the creation of the Lavender Fight for the voice of patients. So good afternoon, Mayor, and thank you very much for being here with us. In the Philippines, for those who don't know it, we work on a decentralized, devolved system of government, and therefore the health system and its effectiveness and what it is able to do is very much dependent on the leadership of our local chief executives. So it is very good that we have here a representative from among our local chief executives. And then right beside him is a representative as well of the Taguig team that you just heard earlier. Dr. Cecille is unfortunately on travel out of the country, but she's very well represented by Dr. Pichisi, who was very much and still very much involved in this particular initiative. And of course, we have Ning here. So probably we start off with a question to Ning. What was the greatest challenge that you had to overcome? And if somebody was to adapt this particular project, what would be your 2 words of wisdom?
Well, I think you have to be prepared that the population of Indonesia are not all literate with the information technology. So we have to combine this project not only based on the online basis, but also to have combined with the hybrid system. So that probably you can do that quite good. And also that the population in Indonesia, not all have the IT, like the computer, the laptop, or even the handphone. So that's why, in class is also important, but they can do it on a hybrid system.
Okay, so that's what we call the silver lining of COVID, where we began to discover and use more and more of technology, but there are also cases where technology may not necessarily be the way to go and it has to be hybrid, which is really most cost efficient if you look at it, right? So Mayor, in terms of the program that you had in Guagua, what was the coverage of this and what similarities do you see with the Indonesia model?
Well, with regards to the ECO, it's similar. However, I just want to tell you how the project started, no? Yeah, during my term, there are a lot of people who are asking for medical and financial assistance. And then mostly, some of them are cancer patients. And remember, when we talk to cancer, it means a bigger amount of money that should be given to them. Incidentally, not all municipalities has the necessary resources, no, to assist a patient. So sometimes a cancer patient will go to the office asking for what do you call that one? Yeah, for when a person has a cancer, the treatment, chemotherapy. How much will it cost? Sometimes 200 plus, 300 plus. So I can give you one session, so something 50,000. So every now and then, until such time, there must be something there must be a plan to support the cancer. So incidentally, I have a staff there who is also a cancer survivor. So why not create a group? So we have created the Lavender Fight. Actually, the first advocacy of the Lavender Fight is to assist the patient for psychological, no, emotional, spiritual. Because sometimes cancer patient point to God, why did you right?
Why me?
Why me? There are a lot of bad people who. So that is one, and then of course, the member includes survivor and cancer patient. So that is and then I told them, please find an avenue or a vehicle so that we can outside entities may help us. So she wrote a lot of letter until such time Rots Philippines collaborated with us. Thank you, Rots, the group. And then incidentally the establishment of the group was October. Yeah, which is the cancer month. Yeah, it's a perfect time. And at the same time, Rots, Philippines, help us to launch the lavender fight. So there was a symposium also, seminar. They invited oncologists and explained. And then that is the start. Until such time, communication, and then the Project ECHO. So we have participants, doctors, and then our frontliners, the barangay health workers. And then that is during the pandemic. Yes. And then afterwards, they graduate. So that's it. Now, the uniqueness of the program is the first, the lavender fight, and then the Project ECHO in our municipalities, we have allocated a certain funds. So it was institutionalized, so that, and then the payment of the request for funding is already systematized following the Project ECHO. So early referral, we can pay the oncologists, and then if there are other laboratory, we can also pay that. And then, of course, the last thing is we have a MOA with an hospital, our referral hospital, but incidentally, this is my last term. So it breaks my heart. It's very hard on my part. This is my pet project, and I saw it. We have helped a lot of people, and then suddenly, I'm not in the government anymore. Well, so we continue it. I am asking Rots if they can make me an ambassador.
Yeah.
Not as a
breast cancer ambassador.
Yes.
Yes.
Without any string attached. Because it's my really advocacy to help people.
Yes. And hopefully your lavender fighters will be able to continue the fight, of course, with your leadership and inspiration.
Yes.
Thank you very much, Mayor, for sharing with us in the Philippine context. That's an example of a public-private partnership model,
yes, and
a collaborative initiative.
And I hope this will be replicated to other municipalities, cities, and then going to the province, and then it will be a national program to be adopted by the Department of Health.
And we're sure that with you there, with the passion that you already have, then it will indeed continue to move beyond Guagua, Pampanga to other areas as well. Thank you for sharing that.
Thank you, ma'am.
And for Taguig, we have very concrete examples. This is a question for Dr. Pichi. It says, and it asks whether you are able to assist even breast cancer patients who are not necessarily Taguig residents.
Right now, the funding that we have is for Taguig residents. But with our patient navigation program, we're also able to help them source out funding from, let's say, DOH or Philippine Cancer Society or PCSO and DSWD, so other sources. So yes, we do help them also, even if they're not Taguig residents.
Oh, that's very nice to know. And there's actually a follow-up question about the extent of free breast cancer services that you are providing right now in Taguig.
We have a breast cancer clinic at Taguig Pateros District Hospital. We have surgeons there who can do the biopsy and also the surgery if needed. And we also have our oncologists for chemotherapy sessions.
Thank you very much for sharing that. And now, as a final round, I'd like to ask each one of you, what would you have as a message for our listeners and our audience in terms of moving forward? We have seen that there are a number of new advances, both in terms of technology, treatment, care, early prevention as well of breast cancer, the very important linkage between early treatment and the start as well of timely treatment. What would be your message?
Thank you. I think, as Dr. Ben Anderson just mentioned earlier, that breast cancer early detection is the most important, and also, of course, the timely treatment is also very important. Early diagnose and find a timely treatment. But for the community, I think early detection has to be educated to the trainer, to the healthcare providers, so that they can educate also the communities as well. So training program is very important. So I would like to hope that this ECHO program can be replicated on a national level.
And very true, and what struck me most as well in terms of what Dr. Ben said is the importance of 2 months, because if it goes to the 3rd month, then in terms of the health outcomes, it may not be as good as if we had done that early detection and started timely treatment within the 2 months. And of course, as you mentioned, the need to be able to build awareness, not only among the patients, the families, but as well to strengthen the capacities of the healthcare system, especially in terms of the primary care, really. And from Taguig, what would your message be?
I guess at the local level, it will be institutionalization of the program through an ordinance. Okay, so even if the mayor is not there, if there's an ordinance, the program will exist or the program will continue. As well as patient navigation program is also, as you said, the backbone of early detection and treatment and diagnosis, which is needed for breast cancer.
And so part of that, we encourage our local chief executives and local government units to be able to engage in patient navigations program, in ECHO program, and as well to be able to provide a sustainability mechanism in the context of a policy instrument like an ordinance. Mayor, what would you be your appeal to other local chief executives?
Well, from the national level up to the provincial level, we have a program. But usually it is being done only on the specific month to which it is the anniversary or it is the founding month of the. There is no continuity on the part of the government. Now, this is the devolution period for all local government units, no, under the Mandanas law. So this is the chance for the fellow or the current local chief executive, no, to study, no, the existing health program of its municipality. This is very important, considering our purpose, no, the early detection, so that we can at least minimize or eradicate cancer sickness in the Philippines. I hope in the future, no, we can also be tagged as the number one cancer survivor in the whole world. So for the local government units, work.
As they say, working together works. And for our breast cancer community, the advocates and champions, I guess the presence of our local chief executive and the model that he has shared, where he spearheaded it, is an indication that if we are not yet advocating to our heads of our various local government units or the national, that we need to be able to start advocating and start reaching out to them. In the Philippines, we have what is known as bibingka, which is something that we eat in the afternoons or during Christmas time. And part of the relationship of that to advocacy is it is cooked by having heat from the bottom and heat from the top. Our breast cancer community are advocates. You are the fire from the bottom. The media people, the local chief executives, those that are stakeholders in the national and regional, they are the fire from top. And so together, we should be able to bring about change. So we'd like to thank everyone who attended and participate in this session centered on discovering and exploring what's new in our region and in the world. We hope that it helped you to discover good practice models, effective innovations that you can then redesign, replicate, adapt, or even scale up if you have something that's already started. We hope as well that it inspires you to further engage, enable, and empower men and women with breast cancer, their families, the whole breast cancer community, for indeed, change can only happen if it is a whole of government, whole of society, and whole of systems approach. And only then can we really say that we are creating a better future, and in the context of COVID, a happier future, not only for men and women with breast cancer, but for everyone in the community that works with us. So what's new? There's a lot. What can we do? There's a lot. So thank you very much once again, and please take a 20-minute health break. And at 3:20 p.m., there is another session in room 1, the title of which is Doing What's Best for Your Patients, Putting the Latest Findings from the 2022 ASCO Annual Meeting into Practice in Low to Middle Income Settings. Again, have a great day, and we look forward to hearing about your successful initiatives, just like we've heard here from Ning, from Taguig, from Guagua, Pampanga. We hope next year it's your turn to share your stories. Be bold, be courageous, create change. Maraming salamat po.